Hello, my name is Robin Bogues, and I will be your nurse practitioner for the day. I'm going to be doing a skin, head, eyes, ears, nose, and throat exam for you today. Do you consent to having this exam done for the purposes of Regis College today?
Yes.
Okay, good. So first, how are you feeling?
Good.
Can I have your name and date of birth?
Evan Tasola, 5/20/85.
Okay. Any pain, anything before we get started?
No.
Okay, so I'm going to begin with the visual exam, and then I'm going to be moving on to more of the physical part where I will be feeling for normal things that's going on with the areas that we discuss. Is it okay if we get started?
Sure.
All right, good. All right, so I'm going to wash my hands and provide privacy, and now we can begin. All right, so first, I am going to note that my patient is alert and oriented. No anxiety noted. First, I will take a look at your skin here on your head, and I'm just looking for any moisture, any dryness. I'm going to assess for any temperature. All right, I'm going to be looking here for lesions. Now, just looking at the scalp. Just taking a look here. I'm looking at for any lesions, looking at the hair, looking at the texture, looking at the distribution of the hair. Okay. Any patterns of hair loss? Nothing there. Okay. Now I'm going to inspect your nails. If I can take a look at your nails, I'm looking for capillary refill. I'm looking for any clubbing. Okay. Good. All right. You can rest your hands for me. Okay, so good. The next thing that we'll move on to will be your, I'm just going to come back up to the head now, and I'm just going to assess the size. I didn't assess the size of it. So the size, and it's pretty normal. And again, just looking for the contour, looking for the symmetry, no deformities, any depressions, any lumps or bumps, and everything looks pretty good. Is there any tenderness? Is there any pain with anything that I'm doing?
No.
Okay. Now I'm just going to look at the face. I'm going to look at your facial expression. I'm looking for your eyes, making sure everything's in place, the symmetry of your ears, your eyes, your nose. Okay, good. Now we will move on to I'm just going to stay with the eyes. So I'm just going to grab a pen light. So first I'm just going to, again, look at the alignment, look at your eyebrows, making sure everything's aligned. Okay. And just going to be taking a look inside of your eyes. Okay. Going to be pulling down, looking down for the sclera, the color, any discharge. Okay. Vascularity, everything looks good. All right. Now with the pen light, I'm just going to be taking a look at the cornea, the lens, and the shape. Everything looks good. The pupils look good. Okay. Now I will assess your visual acuity. All right. I have a Snellen chart posted up over here, about 4 feet away from you. And I want you to cover one eye for me. Okay. And I just want you to read the smallest line that you can of print. It's about 7 letters there. Can you read?
Yes.
Okay.
ELARTUS.
Okay, good. That's good. All right. Now, can you cover the other eye and try to go down at the smallest line or level that you can and read on that one?
REWVTUX.
Okay, good. All right, good. Thank you. Now I'm going to assess pupillary response to light. So I'm just going to have you focus on something in the distant corner over there. And I'm going to just shine the light in both of your eyes. Okay. All right. Now I just want to assess pupillary response to accommodation. So I'm just going to take the pen light, and I want you to focus on just the pen light and where it moves, okay?
Yes.
With just your eyes. Okay, well, perfect. want to assess your visual field. So I'm going to have you cover one of your eyes. All right, and I'm going to cover the same eye on that side. And I'm just going to be using my fingers, and I'm just going to be bringing them in from either side, and you tell me when you do see my fingers, okay? Just say see, okay?
Okay.
All right, good.
Same.
Sorry.
Same. 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 Same.
Good. All right, you can put that one down, cover the other eye, and we're going to do the same exact thing, okay?
Yep.
Okay.
Same. 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 Same.
Okay, good. All right, now I'm going to test extraocular movements, and I just want you to use your eyes only and follow this pen light for me, okay?
Yep.
Okay. Now I'm going to use the ophthalmoscope, and I'm just going to be taking a look into your eyes. I'm looking for the red. I'm going to be looking for the red reflex. Okay, so I'm going to use my right hand and look into your right eye with my right eye. Okay. Okay, and I'm going to do the same. Left hand to your left eye with my left eye. Okay, now I'm going to be taking a look at your ears. Okay. So I've already inspected the ears for symmetry. No lesions, no lumps, no bumps, no pain with your ears, correct?
No.
All right. Now I'm just going to go inside, and I'm just looking for any discharge, the color, looking for the cerumen inside, any bulging. I'm going to come around and look at the side as well. Okay, and I'm just going to pull. Okay. Okay. Now I'm just going to stand behind you. If you can move up, please, just a little bit. Okay. Now, if you can cover one of your ears for me, I'm going to be doing a whisper test. I'm going to whisper a 2-syllable word in your ear, and you tell me what you heard me say.
Hello.
Okay. Do the other side.
Hello.
Okay. Good. Now I'm just going to use my tuning fork, and I'm just going to tap this tuning fork, and I'm going to
So I
place
move
the.
back.
No, this is fine. And I'm going to place the base of it on your forehead, and you just tell me if when you hear the sound, and if you hear it both in both ears, or if you hear it in one or the other. Okay.
Yes.
Okay.
Yes.
Equally in both ears?
Yes.
Okay. Now I'm going to do the Renee's test, and that is just where I tap the tuning fork, and I'm going to place it at the base of your ear. You tell me when you stop hearing the sound, and then I'm going to place it about 1 centimeter from both ears, and you tell me when you stop hearing the sound.
Stop.
Okay?
Okay.
Okay.
Stop.
Mm-hmm. You hear it?
Yes.
Okay.
Stop. I thought you said stop.
Stop hearing it if
No.
it is. Okay. You stop.
Yes.
Okay.
Yes.
Okay. Okay. I'm going to use the otoscope one more time, and I'm just going to go at your nose. Again, I've already assessed your nose for symmetry. I'm just going to palpate the nares to see if there's any obstruction. You can breathe good. Fine.
Yes.
Okay. Can you lift up? Okay. Looking for color. Looking for discharge. Everything looks good. Okay. Now I'm just going to assess your maxillary and frontal areas here, just to test and make sure everything feels fine. Okay, that's good. Now I'm going to place 2 cents below your nose. After you close your eyes, please, and you tell me what it is that you smell.
Cinnamon.
Okay, good. Okay.
Coffee.
Yes. Okay. All right, I'm going to put my gloves on. I'm just going to look at your lips, looking for the color, looking to make sure that there's no cracks and bleeding. Okay. All right, if you can open your mouth for me, I'm going to be using the pen light to take a look inside. Okay, I'm just looking for color, the mucosa, looking at your teeth, symmetry of your tongue, making sure there's nothing going on with your teeth. Okay. All right, good. If you can lift your tongue for me. Okay, move from side to side. Okay. All right, can you say ah for me?
Ah.
I'm looking at the pharynx here, the tonsils. Okay. Okay. Lift the tongue up one more time for me. Okay. All right, good.
What's good?
Everything's good. Sorry.
That's all right.
Now we will move on to, I want to just assess your lymph nodes. Okay, so I'm just taking a look at the neck. I'm looking for symmetry of your neck, making sure that there's no masses, no bulging, no lesions. Okay, everything looks good. Okay, no visible lymph nodes or anything. All right, so now I'm just going to palpate the lymph nodes. I'm going to go behind you one more time, if you can move up just a bit. Okay, all right, so right now I'm assessing the preauricular in front of the ears, the postauricular, the occipital, okay, the submental, okay, and the submandibular, okay, and the tonsillar, okay. All right, now the superficial cervical, okay, then the posterior cervical, okay. Now I'm going to palpate for the deep cervical, okay, and if you could shrug your shoulders up for me. I'm just feeling for the supraclavicular lymph nodes here, okay. Okay, good. All right, and now while I'm still behind you, I'm just going to palpate the trachea, okay, making sure there's no deviation, okay, and now I'm just gonna have you swallow for me. All right, that's just to assess the thyroid gland. Okay, okay, pretty good. Okay. Well, that concludes today's exam. Thank you very much for participating with me. I will gather up the findings and be back to discuss everything with you.
Thank you.
Okay. Have a good day.